Hey guys, welcome to the Friday Live here with Sprouting Up Chiropractic in the Hunter Valley. Today we want to talk to you about low back pain. In particular, we're looking at the discs, lumbar disc in particular. Now, a disc in the spine is there as a shock absorber, as one issue in there between our vertebral bones. So these are, because they allow a lot of freedom in movement, they are prone to injury. And they can be quite severe at times, so it can create inflammation and pressure on our nerves. In particular, we start thinking about sciatic pain. So this pressure could come from as simple as a sprain, creating inflammation, or more severely, it could come down to that disc herniating and some of the fluid and tissue from inside coming out and putting pressure on where our nerves exit down to our lower limb, as well as other areas of the body. So when we think about this, a lot of health professionals would agree that a conservative approach initially should be done, where we look at things like physical therapy, lifestyle modification, and in some cases pain management as well. And chiropractic certainly fits within that realm.
Okay, so when we're talking about acute lower back pain, which have a disc herniation or disc injury origin, it actually sometimes creates some sort of sciatic pain, and it creates disability in people's life. So as Dr. James just said, there are a lot of many options, exercise therapy, physical therapy, we can use medication, there are operations that is available. Also, chiropractic care is evident that is going to help with this injury as well. Obviously, we would try to go for more conservative options first before going down into operations options. And then what we need to do is to screen if there's any potential fracture in there, something a little bit more serious. If there's any bone weakening condition that contraindicate for us to do some sort of chiropractic manipulations. So what we have is there's some evidence that shows that chiropractic care for acute and chronic lower back pain, regardless it's coming from a disc injury or a sprain or strain in the muscles or joints, it is actually having some favourable outcome to help people increase their range of motion, decrease their pain, and also decrease the medication use to help with their pain.
Yeah. So when we look at this, we start thinking about what's going on in through that lower back. So we start thinking about with the muscles. Are the lumbar spine erectors working properly? Are they overactive? Are they underactive? Is the core firing properly? So we start looking at not only what we do as chiropractors with the joint manipulation and adjustments, but we also look at making sure the core is firing properly, that the lumbar spine is working, the lumbar erectors through the spine are working properly. So we look at exercise, rehabilitation, and as well as lifestyle modification. So if you have low back issues, or you know somebody with a low back issue, particularly when we start talking about a disc issue, they're better treated sooner rather than later. So why not give us a call and have a chat to us and see how we can best help you out. All right, guys, have a great week.
Have a great weekend. Bye.